Hello, my name's Tamika, and you're listening to A Walk in the Park with Animal Friends.
So we are here today with Dani from Dog First Aid. We also have little Mabel dotted around the studio, who is one of the family here at Animal Friends. So if you do spot her in the studio, don't be alarmed. Dani, thank you so much for joining us today.
Thank you for having me.
I want to start by asking you just for you to tell us a little bit about yourself, a little bit about Dog First Aid, and how you got to where you are within it.
So Dog First Aid started in 2013. The lady who started Dog First Aid actually had a pet care business, and she had a couple of Dog First Aid incidents and went looking for Dog First Aid training and couldn't find anything. So noticed a gap in the market and started Dog First Aid training, and it was very localised around here in Wiltshire at the time. And then in 2016, she franchised the business so that more dog owners could learn the skills, more people could have the confidence to act in an emergency. And then myself and my business partner, Theo, took over the reins in 2020. So I actually joined as a franchisee in 2018, took over with, as I said, my business partner in 2020. So yeah, I've been director of Dog First Aid training now since then. So about 4 years.
It's amazing. Well done.
Thank you.
That's so exciting. And so then why would you say, it's probably a wide question, but what would you say the main reason for learning Dog First Aid is? Why is it so important for dog owners?
In extreme cases, it can save lives. And we do hear back from people regularly who have gone on to save their dog's life. Accidents can happen at any time. And the topics we cover, I know we're going to get into that shortly, but there are certain situations where what you do in the first sort of 5 minutes could mean the difference between your dog surviving or not. And as a dog owner and a dog lover myself, you know, I couldn't ever imagine being in a scenario where I didn't know what to do and my dog lost its life. I mean, that would be absolutely heartbreaking.
Yeah.
So things like, you know, if your dog's choking, which I've experienced with 2 of my dogs, if they suffered a major bleed, if they had a really bad burn, or even if their heart stopped, you know, if we're not able to take action immediately, or if we hesitate because we're not sure what to do and we don't want to do the wrong thing, that could literally mean the difference between life and death. So it's really important for people who have a dog or anybody who works with dogs to know these skills, because it can make a huge difference.
And it's such vital training, obviously, like you say, for dog owners to know.
Yeah.
So how is it that Dog First Aid offers that training? Is it just all online?
No, we do classroom-based training, so it's about 4 hours. I always allow 4 1/4 because we pack it full of content. There is a huge amount in there. And depending on the size of the group, you know, and depending on the level of interaction that you get, I always allow a little bit of extra time, but we call it a half day course. So we deliver that in a face-to-face environment so that people can you know, we have some practical sessions. People practice CPR on a dummy dog. So, you know, in human first aid, you've got Rhesus Annie, we've got Rhesus Cassie. So we practice CPR. People get the chance to do practical bandaging as well. So we do offer it in a face-to-face group environment.
What are the different type of courses then that you offer within that?
So at the moment, it's just the one course. So the course that we offer currently is this 4-hour. It's called Emergency Canine Care. What we're developing at the moment, which is quite exciting, is the Ofqual Level 3.
Okay.
So our current course is CPD accredited. So for people who work with in the dog sector, they're often required to accumulate CPD hours or CPD points, so continual professional development. So it is accredited by CPD, but it's not a formally recognised qualification. So that's what we're designing at the moment, which has a formal exam, but then that person has a recognised qualification as well.
That's exciting.
Yeah.
So then who are your courses suitable for? Is there an age limit on them?
We don't tend to accept kids under 12.
Okay.
By exception, we might, because, you know, 2 12-year-olds are not the same, right? So it's really down to the individual trainer. If if we had an 11-year-old who was very mature and whatever, but typically it's around 12. There's no upper age limit. Anybody can come along. But I think under 11, under 12, to get people to sit down and concentrate and focus on the course content for 4 hours. In school they would have more breaks than you would expect an adult to have. So sort of from 12 upwards.
I even think 13 is a really great age for that, because still at that young age and about the time where maybe they're trusted more to be left at home. So being left at home alone with the family pet, if something goes wrong, they've got that skills to hand, which is really good to have.
We do sometimes go into schools as well and do little mini sessions. One of our franchisees in Hertfordshire does it with preschoolers, where she'll go in and just do a mini session on where to find a dog's pulse and things like that. Because I think it's great to get kids engaged at a young age in that kind of level of not giving them that responsibility, but that awareness of, this is what we would do. And I had a lady on my course at the weekend, actually, who said that her son came home from preschool and they were being taught about, calling 999 and what to do if mummy doesn't wake up or stuff like that. And I think that's brilliant at a young age to have those kind of life skills. So
definitely.
Some of our franchisees do go into schools. We've worked with schools for children with learning difficulties as well, and autism and things like that, because it is kind of practical based learning as opposed to chalk and talk. They get to have a go. So we do stuff with younger people outside of the sphere of our normal sort of public courses.
That's so great. And is there any then misconceptions around dog first aid? Do people come into these courses with a certain vision of how they assume it'll go, but it's been completely different?
I guess the only difference that I would say people find from what they were expecting to what they get is it's a lot more detailed, probably. We get a lot of feedback consistently that I had no idea I would learn as much as I did. And we do that in a really accessible way. We don't use lots of vet terminology. We're dealing with dog owners a lot of the time. And whilst we have the veterinary training, so all of our trainers are trained by veterinary professionals, so they do know the language, we don't tend to use it because if people don't recognise it, they disengage.
Exactly.
So, a lot of the feedback that we get is, I learnt so much, but it was in a really accessible way and it was really easy to understand and explained well.
That's such a great way for it to be, because like you say, you need that accessibility for everyone. Dog ownership is so much more popular now at the minute as well, so there's going to be people from all walks of life that should be able to access information like that. So it's so great 100%. That they're able to. So then moving a little bit closer into the first aid itself, so what would you say are some of the most common injuries that you would find within dogs?
So we kind of take the lead from our vets on this, because obviously the vets and vet nurses that we work in, they still work in practice. So they are on a regular basis seeing stuff. We also know from the data you guys provide us with the types of claims that you get most often. So the types of scenarios that are most common, bleeds and bleeding injuries is one of them. Choking is another that's relatively common. And probably the most common is dogs eating something that they shouldn't. And I know from personal experience, I don't have her anymore, but I had a staffy. We lost her about 18 months ago, but
I'm sorry.
Thank you. But she made it to 19. So
wow.
She was a really good age. But during the time that we had her, and we had her from 11 years old to 19, she stole mince pies. So that was a vet visit. She stole my stepson's zinc tablets. Zinc is toxic to dogs. So that was another vet visit. She managed to get into a closed tub of celebrations around Christmas time.
A closed one.
Closed
Skill.
tub. Yeah, skills. And that was when we did induced vomiting, or the vet induced vomiting, that was rainbow vomit, because of course she ate all the wrappers as well. And when I talk to people on courses, I always ask with every scenario, does anybody have any experience of this? And when I ask the question, does anybody have any experience of their dog eating something they shouldn't? everybody's
hands.
hand goes up, because that's really common.
Yeah.
So being able to recognise the signs of toxicity, which are very varied depending on the toxin, is really important for dog owners. And one of the key messages that we give people is not to watch and wait if they think their dog's eaten something toxic, because depending on the toxin, you might not see any symptoms for 48 hours. So the types of things that, affect liver and kidney function, for example, you might not see anything for 48 hours. You might think the dog's perfectly fine. And then they start drinking excessively and urinating excessively. And they might have yellowing of the gums or other mucous membranes. And at that point, they're already really in trouble. They're in kidney failure. So things like that, people wouldn't necessarily know without having done the course.
So when a dog is injured, what, as an owner, should we understand the most if we are to come across our own dog with an injury or even another dog? What's the one thing that we should do first?
There isn't a single thing. So what we do is we train people how to look out for signs of things that have gone wrong. Right. So one of the things, so we talk about the foundations first of all, and there's a safe way of kind of assessing a dog that's been in an injury or has had some kind of incident occur. So there's 4 steps that we ask people to follow in every single scenario. The first one is a visual risk assessment. So to assess the scene, because if we go rushing in, and let's say a dog's been hit by a car, for example, and we go rushing into oncoming traffic, we could become the injured party. Likewise, if they've been electrocuted and we haven't turned off the source of power. So, lots of different scenarios where we could end up becoming injured and harmed, and that doesn't help anybody. So, first step is to do that visual risk assessment and make sure it's safe to act. The second thing is to call for help. So there's always going to be a use for a second pair of hands. So whether it is calming a dog owner, keeping other dogs out the way, calling the vets, taking over from chest compressions when you get tired, helping to carry a dog that's unable to walk, there's always going to be use for somebody else. The third thing then is to secure the dog and muzzle them. Okay. Now, most people haven't muzzle trained their dogs. People tend to muzzle train their dogs for a very specific reason. So we train people how to use a normal stretchy bandage out of a first aid kit to pop a temporary muzzle on their dog so that they don't put themselves at risk of being bitten. Because even if your dog is, soft as butter and absolutely, gentle and everything, it's that fight or flight response. If they're injured, if they're in pain, if we're causing more pain by putting pressure on a bleed or lifting a dog with a fracture, they may bare teeth, they may bite us. So we can use a part of our first aid kit to actually secure the muzzle to make sure that we're not at risk of being bitten. And then the fourth thing then is to do a body exam, so to assess exactly what's going on with them. So it might be something that's really, really obvious. We might have witnessed the incident happening, and we know exactly what's going on. But it could be that we just find a collapsed dog and we need to ascertain what's going on. So we train people in what to look for to be able to understand, if your dog's just lethargic, not really themselves and not really able to get up, how do I go about understanding whether that's anaphylaxis or shock or cardiac arrest or low blood pressure or low blood sugar? What am I looking for to be able to understand what's going on, and therefore what are the right things to do?
And you mentioned there a full body exam, so that's your fourth step. What is included within that full body exam?
So first of all, it's a general view of the dog. So if we haven't witnessed the incident taking place, what can we see? Can we see blood coming from the dog? Can we see a limb twisted in an unusual direction? Are there any clear signs as to, is the dog foaming at the mouth? Are they making a choking sound? What are the visual and auditory cues that will tell us what is happening with the dog. So there's a bunch of those that we go through, and of course they don't always apply to every single scenario. But then we sort of look at different body parts to look for clues of secondary issues that might have occurred as a result of the injury. So one of the things, so there's lots of things that could send a dog into shock, for example. So, you know, whether it's heart failure or blood loss or excessive vomiting and diarrhea or anaphylaxis, lots of different things can lead to shock, but shock in itself is potentially fatal. So shock is when the organs aren't getting enough oxygen. And there's loads of different reasons that might happen, but there are some really clear signs that a dog's in shock. So we train people how to look for those signs so that, you know, you might know that your dog's bleeding, but unless you look for signs of shock and treat the shock as well, the shock could be fatal. So it's not just about stemming that bleed, it's also about dealing with the shock. So it's things that people wouldn't necessarily think about, and things that, you know, ultimately could be fatal for the dog. And actually, if we don't act in the moment, if we wait until we get to the vets, we could arrive at the vets with a dog that's unfortunately passed away. So it's really important to know that stuff in the moment.
And then a dog's vital signs, so taking their pulse, for example, is that the same as humans?
Yes and no. So their pulse range is very different to ours.
Okay.
Where we would take the pulse, it is similar, but most people aren't familiar with where we take the pulse on a dog, and that that humans have a pulse there as well. So they do have a radial pulse. It's just behind the paw pads.
Perfect.
If a dog goes into shock, that pretty much disappears.
Yeah.
So we train people how to take the pulse on the femoral artery. So the femoral artery is inside the dog's back leg.
Oh, okay.
So it's either side of the dog. We also have a femoral artery. So the femoral artery is named after the femur, which is the thigh bone. Okay. And it's the main artery that supplies blood to the limb, to the hind limbs. So if you feel inside your dog's back leg, and if I just use this guy as an example, so it would be just inside their back leg here. If you feel inside there, you will feel what feels a little bit like a rubber band running down the back of the inside of the back leg, and that's that artery. Okay. So if we just place 2 fingers on that artery, just with a feather-light touch, we don't want to stop the flow of blood, and we can feel the pulsing there, and that's the strongest pulse in the event a dog goes into shock, which is why we recommend that people take it there.
And did you say humans have it as well?
Yeah. So if bizarre. God forbid, if you went into A&E, for example, and you had a head brace on, and there was a chance you were in shock. So again, your radial pulse will become quite weak. The doctors take the pulse in the femoral artery, which is kind of there.
So Dani, you mentioned there about obviously the different pulse points for a dog. What about their heart rate? What's a normal range for that?
So it really depends on the size of the dog. So there's a massive range. It could be anything between 40 beats per minute and 140 beats per minute, which is a huge range, much bigger than the human range, because we are largely of a similar size. Whereas if you think about the diversity of dogs, you might have a toy breed. They're going to have a far faster heart rate than a giant breed. So things like, you know, Great Danes and Russian Terriers and those types of, you know, huge, small pony, Leon Burgers and that type of thing. They've got a very slow heart rate compared to the very small dogs. So unless you're familiar with what your dog's normal is, if you take their pulse after an incident or accident to see if it's gone up or down, well, you haven't got a starting point because there isn't a standard normal across dogs. Age and fitness play a role as well, just as it does with us. But the biggest thing is how big the dog is. So it's useful for owners to understand what their dog's normal heart rate is, because then if they are ever concerned about their dog, maybe they're behaving weirdly, or maybe they have had an incident or an injury, they can take their pulse. And if it's wildly different to normal, then they know that there's an issue, and they can get the dog to the vet as quickly as possible.
Perfect.
So we recommend people do that on the femoral artery. If you just count the number of beats for 15 seconds, then multiply that number by 4. So if in 15 seconds you get 10 beats, then your beats per minute is 40.
40. That's really handy. Thank you. You mentioned at the start, kind of one of the main injuries you can tend to see is choking.
Yeah.
So what is an owner to do if they come across their dog choking?
There's 4 different techniques.
Ooh.
So choking is one of the more complex things
It sounds
that we cover. So it really depends on the size of the item, first of all. So if they were choking on something bulky, let's say a tennis ball or a hide chew, please don't give your dogs hide chews, by the way. Really, really slippery when wet. They're really hard to get hold of to actually pull out if your dog does start to choke on them. So a lot of the advice we give on the course as well is kind of preventative stuff. But if they were choking on something bulky like that, we can actually milk that item back into the throat, into the mouth. So if you kind of place your hands on your dog's neck and find the item that's not meant to be there, probably worthwhile getting familiar with what your dog's neck feels like ordinarily, because we don't want to sort of milk their voice box out. But you would find, say, if it were a tennis ball, you would find that there, and we're going to apply firm upward pressure. We can actually bring that item back into the mouth.
Oh, okay.
So you may have seen videos that are going around, you see them on veterinary pages and YouTube and stuff like that, of a vet actually sitting across a dog and doing that in this way, and kind of milking a ball out of a German Shepherd's mouth. In terms of prevention, we always recommend that anything bigger than kind of Jack Russell size, always go for the next ball size up. Because a lot of people give, Dobermans or Labradors or that kind of size of dog a tennis ball. Well, if it could conceivably fit in their throat, then it's a risk. And there's lots of brands that do bigger sizes. Always go for a size of ball that's bigger than you think could fit in their throat, because that's one of the common ones.
You even see the little tiny ones now, don't you? The little tiny tennis balls for smaller breeds, so they're definitely a no-go.
Definitely a no for your bigger dogs. I mean, they would be for your,
tiny
teacup
little
chihuahuas and that type of thing. So, it's the most common thing is tennis balls and the tennis ball launchers and stuff for dogs that are, maybe 20 kilos or more. That's definitely could be inhaled and cause a blockage. There are other brands as well that do balls that are full of holes. So if it did get stuck in the airway, the dog's still able to breathe.
Great.
So there's different brands that do that as well.
So that's for a dog choking on a bulky object. What about a smaller one?
So a couple of different techniques. One thing to note is that if your dog is coughing, it's not truly choking. So it's useful to recognise the sign. So if they are doing it needs to be silent for the airway to actually be blocked. If they're coughing, then they are able to get it out themselves. But if they were choking on something smaller, and I have had this with Ian, one of my dogs, he started choking on a bit of kibble. It was the most frightening thing, despite being trained.
Of
when
course.
it happens to your child, I'm going to say child, when it happens to your baby, it's terrifying. So the other two techniques, one is to shake your dog pretty vigorously. So we're going to pick them up by the back legs. Their front limbs would still be on the floor.
Right.
And we're going to shake them quite vigorously from side to side and jerk them back and forward. And that's really to try and dislodge anything that's trapped, so that the dog can then get a cough behind it and try and get it out. The other one is a technique called coupage, which is used by physiotherapists to actually clear the lungs of fluid, and again is designed to induce a cough. So that's something that we train on our courses, how to do coupage. And as an absolute last resort, we would use the abdominal thrust technique, which is very similar to how you do it in humans, but obviously the dog's physiology is different.
Yeah.
But we only train, this is only if your dog has started to go floppy and you're pretty sure if you don't do it, they're going to lose their life, because it can cause fatal injuries in dogs. So it's certainly not the first thing that you try. But if you think, you know, my dog's gums are blue, they've gone floppy, they're going to die if I don't take, you know, really, really serious action here, then we would recommend the abdominal thrust technique, which people might know as the Heimlich maneuver. Not able to use that term anymore, so it's now called abdominal thrusts.
Okay, thank you for that tidbit as well. I'm learning loads of stuff today.
Excellent.
So, Dani, what are the main rules when it comes to CPR for our dogs?
CPR, so it stands for cardiopulmonary resuscitation. So cardio relates to the heart, pulmonary to the lungs, and resuscitation is the act of beating somebody's heart or breathing for them in order to revive them. So the first thing that we need to do is make sure that the dog is definitely unresponsive, because a dog could be collapsed but responsive.
Okay.
There are reasons, you know, that could be injury, low blood sugar, low blood pressure, lots and lots of different reasons why a dog might be collapsed, but they're conscious. So first of all, we need to find out, are they conscious or not? So we do this by approaching the dog, calling their name or clapping if we don't know the dog's name, to see if we get a reaction to that. If we don't get a reaction to that, we're then going to use touch. So we would tap them on the back, or we could use our foot. If the dog's not known to us, it's probably less risky to use our foot. And if we don't get any response to that, we're fairly confident that this dog is actually unresponsive. So the first thing we're going to do, and this is in line with the Recover guidelines, there's an organisation called Recover, which is largely made up of UK and US veterinary professionals, and they write the rules around canine CPR. So the Recover guidelines, slightly different to human CPR, which is that you would do ABC, which is airways, breathing and circulation.
Yeah.
With a dog, we're going to do CABC. So the first thing we do is check, is the dog's heart beating? Do they have circulation? So we can either check this on the femoral artery, which is how I explained before, we take a dog's pulse. If the owner's panicked and they think, I'm not sure I would be able to find the femoral artery, maybe they've not looked for it before, maybe they have a dog for whom it's quite hard to find the pulse on the femoral artery. Some dogs you find it immediately. Other dogs, it can be harder, particularly if they're any dogs that are overweight or have a lot of fur covering. It's harder. Just put your hand on the chest. Can you feel a heartbeat? That's what I recommend. So in the absence of a heartbeat, we need to start compressions as soon as possible, because what actually kills mammals is lack of oxygen to the brain. So if we start compressions, the oxygen that's already in the blood in the body is going to get circulated around the body and reach the brain. So in a healthy dog, the blood would be 95% oxygenated. So by pumping that blood around the body, we're going to get that to the brain. So we're going to start to do compressions, 2 minutes of chest compressions, and we're going to do those at a rate of 100 to 120 a minute.
Okay.
So it's really pacey.
Yeah.
And we are doing those a third to a half of the dog's body depth. So ideally, we want the dog lying on their right-hand side, because the heart's on the left.
Yeah.
And we're going to interlace our hands, just like we would for human CPR. It doesn't matter which way round, whatever's more comfortable.
That.
Yeah. And if the dog's under 10 kilos, we're going to put our hands, so if they're lying down like this, if the dog's under 10 kilos, we're going to put our hands about here, which is where the heart is. And if the dog is over 10 kilos, then what we're going to do is there's a natural arc between the forelimbs and the hind limbs. It's the rib cage.
Okay.
So for a dog over 10 kg, we're going to put our hands at the highest point of the rib cage. Okay. So we're going to do that, and we're going to keep our elbows locked. We don't want to rely on upper arm strength, because we'll become tired a lot more quickly. So we're actually using our body weight. We want the dog on the floor, by the way, and we're going to kneel over them, shoulders directly above the dog, and do between 200 and 240 compressions to get that blood pumping around the body.
Okay.
So once we've done that,
Yeah.
then we'll do our ABC. So
Right.
A is airway. We're going to check if there's anything in the dog's airway. There might not be, but it's quite a common reason why a dog would become unresponsive. It's because they've choked on something. Maybe there's something in the airway. If there is, we can remove that item. We don't need to worry at this point about a bite risk because, of course, the dog's unresponsive.
Yeah.
Whereas with a choking dog, the dog's awake, it's panicked, that there is a risk they're going to bite you. Once we've checked and cleared the airway, if there's anything in it, we're going to check if they're breathing. Put our hand in front of the nose, see if we can feel breath on the nose, or we can listen for breath. We can also see if their chest is rising and falling.
Okay.
And in the absence of breath, we're going to check circulation again. So again, whether it's the femoral artery or whether we put the hand on the chest again and see if the heart's beating, we may have reinitiated the heart with those 2 minutes of compressions. That's only really likely if we started compressions really quickly. So
Okay.
we've got people who, I've got 2 cases of people who have reached out to us who did CPR on their dog and saved the dog's life.
Wow.
So people who had been on the course. And in one instance, it was a lady who was walking her dog on the lead and the dog collapsed. So she was there immediately took the pulse, immediately recognised the absence of a heartbeat and started compression straight away and reinitiated the heart.
That's amazing.
Whereas if the dog had been lying there for 5 minutes, that may not happen. So that makes a really big difference. So having checked airway, breathing, circulation, assuming there's no breathing or circulation, we need to carry on with compressions.
Yeah.
But this time the compression system changes. So instead of 2 minutes, we're going to do 30 compressions, 2 breaths, 30 compressions, 2 breaths, 30 compressions, 2 breaths.
Okay.
And then we check pulse and breathing again. If we don't have pulse and breathing, 30 and 2, 30 and 2, 30 and 2, check pulse and breathing again. What's interesting is the rescue breaths are mouth to snout, not mouth to mouth, because you're unlikely to get a seal around your dog's mouth, particularly the larger dogs, but even smaller dogs, their mouths just go back a lot further than ours. So we're going to put our hands over the muzzle and close the mouth. We want any breath that's going in through the nose to get to the lungs, not come out the mouth.
Yeah.
Put our mouth around the nostrils and put breath in through the nostrils. So put a breath in, we're just replicating what a normal breath would look like. So as you're doing it, you're looking down the dog's body, looking for that chest rise and fall, let the breath out, put another one in, back into your next set of 30 compressions.
And with the compressions, you mentioned there that they can be quite pacey. So for humans, they always teach you in school growing up, don't they, that it's the Bee Gees, Staying Alive. I know there's other songs out there as well. Is that the same for dogs?
It's the same tempo.
So the exact same tempo, so we can hum the same song.
Staying Alive, Nelly the Elephant. For the younger listeners, Baby Shark.
Oh, really?
I actually trained a group of apprentices who were 16 and I mentioned Nelly the Elephant and they all looked at me like,
who's that?
Never heard. I've never felt as old in my life.
And it's Who Let the Dogs Out as well, isn't it? Which is quite...
Yeah. So that type of pace. There's also another one, Bites the Dust, but I don't suggest singing that out loud.
Yeah, that's probably
just in your head.
Especially if it's not your dog.
Yeah.
It's a bit sinister, isn't it?
Yeah, 100%.
Thank you so much for sharing all that about CPR. It's
welcome.
such a vital thing to know and to be aware of. But you did say it can be a little bit uncommon, can't it, to have to use it, but it still doesn't diminish the fact that everyone should have that skill set established.
It's like humans, you know, the number of people you know have had to use CPR is actually very low. And it's one of the least common things that will happen to a dog is that it will go into cardiac arrest. But if we know what to do, again, it could mean the difference between that dog surviving or not. And we know because we've heard back from people that they have actually saved their dog's lives. So it's very worthwhile knowing, even though it is a rare occurrence.
Yeah, it's just great knowledge to have.
Yeah.
And another thing I've come across lately that I'll put my hands up and say I don't have and didn't even think about needing to have until I came across it was a dog first aid kit, Dani. And you've talked about how important they are and how important it is to have on you. Do you want to talk a little bit more about those dog first aid kits, maybe what's in them, what you recommend to have with them, and when you should be bringing one with you?
Yeah. So dog first aid kits are, I would say, have it with you whenever you are with your dog. So I take one on, well, I don't. Winnie takes one on a dog walk. She's very responsible for a 3-year-old.
What a good girl.
So we have dog first aid kits that are, they have a press stud button. And so I just pop it on her harness.
Nice.
So when we're out on a walk, she takes it, because the likelihood is, if something's going to happen, it's potentially going to happen on a walk. So there's no point that being at home or in the car. If you're out on a walk and your dog cuts themselves on something, or gets into an altercation with another dog, or falls or something like that. So some of the key things to have in your first aid kit that are really useful: gauze swabs and bandages to be able to deal with any kind of bleeds. We teach people on our courses how to put a pressure bandage on a dog. We don't train people how to do proper veterinary bandages, because they're designed to stay on for sort of 2, 3, 4 days. And if your dog needs a bandage, they need to be seen by a vet, because it might need stitches, it's going to need properly cleaning, they might need supportive care, they might go into shock. There's lots of different things that could happen. But we train people how to do a pressure bandage, which is designed to keep pressure on the wound whilst you get to the vet. So having bandages and gauze swabs in your kit to be able to do that, they're really key. Plastic tweezers are very, very useful. We specifically mention plastic because if you were to try and get something out of your dog's throat and you just needed that bit of extra reach, you couldn't reach down there, plastic is ideal because it's far less likely to do damage to the dog's throat.
Makes sense, yeah.
So that's useful. A foil blanket has so many uses, it's untrue. So obviously for hypothermia, warming your dog up is really, really important. There are certain conditions such as shock where your dog will lose body heat, so having a foil blanket's really good. But they also have other uses, such as you could use it as a stretcher. They're you can get them sort of 2 meters long. You double that over. If you've got a dog that it's difficult to carry on your own, they're actually really tough despite being quite thin. So you could use it to carry a dog. So they're really helpful to have as well. What else? Saline pods of saline solution. They're useful for if the dog had grit in its eye, say, or maybe a chemical had splashed into the dog's eye and you need to rinse the dog's eye. Saline solution has the same pH value as the eye, so it's less of an irritant than standard water would be. And they can also be used for flushing out a small wound before you actually put pressure on it. So if a wound were gushing with blood, I would miss that step, and the objective is to get pressure on the wound as quickly as possible. But a small graze or something you could flush out with the saline solution. Scissors to cut your bandages, microporous tape to tape a bandage on, cleansing wipes. One of the things that is really useful for your home first aid kit is a digital thermometer.
Okay.
So a dog's temperature range, unlike their pulse, which is a huge range we talked about before, dog's temperature range is typically between about 38 and 39.1. So that's across all breeds, all shapes, all sizes. The only variation for that really would be if a dam, so a female pregnant dog, is going into labour, then her temperature would drop. But it's useful to have a thermometer because, again, if your dog is acting in a way that's unusual or showing any kinds of symptoms, a temperature check is a really good way of sort of identifying if something is wrong with them. So if it's outside of that 38 to 39.1 range, they could be hypothermic, i.e., too cold, or hyperthermic. And there's lots of different reasons why that might occur. So, if they're too hot, it could be heat stroke, it could be infection, it could be, a number of different things. But being able to measure that, again, is a good way of kind of identifying, right, I need to get my dog to the vet because their temperature's not normal. So the same with the pulse, the same with the breathing rate. Anything outside of normal range, we need to get them some help.
Great. And then what's the one big mistake that someone can make when it comes to their first aid kits?
There's a couple of things, I suppose. One is not having it with you.
The big one, yeah.
You know, people have a first aid kit at home or they have a first aid kit in the car. But if you're a mile from the car because you're doing a big rural walk, that's no good to you. So I definitely recommend, I personally have a large first aid kit that's really comprehensive that I have. As a first aider, have one in my car and one at home. But I have a smaller kit that I take on walks, which has everything I would need. So, well, it's basically got the gauze swabs, the bandages, the saline, and the foil blanket. So that's everything I'm going to need for something that's likely to happen on a walk. The stuff then that I have at home is the more expansive kind of stuff. Including tick tools. Didn't talk about tick tools, but that is an absolutely vital piece of kit, and antiseptic spray, all of that type of stuff. But yeah, just not having it with them. So if people have a really comprehensive kit that's really bulky, they're not going to take that on a walk.
Yeah.
So I would recommend whether you buy a walk specific one or whether you just take the items that are going to be useful for an injury on a walk and just put them into a smaller pouch or something and make sure you have that with you. Yeah. So in the absence of a first aid kit, of course we could use a sock or a scarf or something, but they're not sterile, so it's not as good. So number one, not having it with you in the first place. There are also a couple of things on the market that we don't necessarily recommend. So there are dog first aid kits that you can buy with tourniquets in them. And then the other thing is for people just to be very, very careful with vet wrap.
Okay.
So vet wrap is this elasticy looking bandage that vets will apply on the outside of a proper veterinary bandage. So people will probably recognize, they're usually brightly coloured. They might have paw prints on them. So it's really important if people do use vet wrap that it is a very temporary thing. And the reason for that is a couple of the vets that we work with have actually ended up amputating dogs' limbs because an owner applied vet wrap, left it on for a couple of days. And what typically happens when a dog's got an injury is that injury site is going to swell. So at the time the vet wrap was applied, it wasn't too tight. Over a period of time, it becomes too tight because of that swelling and it stops the flow of blood to the limb and the limb becomes necrotic, i.e. starts to die. And, we've had a couple of vets actually have to amputate limbs as a result of that. So it can be a really useful tool if you are in a muddy field and you've had to apply a limb bandage to put vet wrap over the top of that to prevent it from getting wet and muddy whilst you get back to the car is great, but then go straight to the vet to have the dog seen. Yeah. And then they're going to cut it off. We're not going to end up with this lack of blood supply to the limb. I also recommend that as you take the vet wrap off the roll, give it a good stretch to, I'm going to make up a word now, de-elasticate. Is that a word?
I assume so.
But to take some of that tension out of it, then apply it. It's really handy. It adheres to itself. It's then waterproof. Get the dog back to the car, but then get them straight to the vet so it can be cut off. Don't leave it on for several days. So they're the key things that, I think people can get wrong sometimes.
Great. So there's some great tips there for first aid kits and really encouraging for everyone to go out and purchase one for the dog. I know I will be as soon as we're done here. I'll be straight online for a little dog first aid kit.
I've got them in the boot.
Oh, you got a card payment?
In a trotter, in a Rodney Trotter way. You're too young to remember.
Oh no, only Fools and Horses. I'm not. Don't worry.
Got a car full of them.
So any of the stuff that we've just spoken about, all of your advice, is any of that different for a brachycephalic breed? So obviously that is a breed with a flat nose. So like your French bulldogs per se. Is it different?
The nasal cavity that helps with thermoregulation in dogs is a lot smaller in brachycephalic breeds. So from a first aid perspective, one of the things that they can be really affected by is heat stroke. So they're a lot more prone to heat stroke than a longer snouted dog is. And there are other risk factors for heat stroke. There's, if the dog's dark in colour, if they're overweight, if they're elderly, if they're a puppy, but any combination of those, and of course you're increasing the risk factor. But they are just going to struggle in the heat a lot more than a dog with a longer snout. So, from a preventative point of view, we always point out to people that, there is no set temperature that's safe for dogs, because depending on how many of the risk factors they have. They may not tolerate the same temperature as, so if you had a flat-faced, elderly, dark, overweight dog, they're going to need far lower temperatures than a slim, fit, white, long-snouted dog, for example. They're just not going to cope with the heat quite so well. So from a preventative, we would do exactly the same things in terms of the first aid actions, but it's just being aware of the risk factors. So on the course, we don't just talk about first aid actions. For every topic, we talk about what is it, how do you recognise it, how do you treat it if it happens, but most importantly, how do you prevent it happening in the first place? Because if we can do that...
You don't want to have to use the training, do you?
We don't want to have to use the training,
Exactly. And that's everything I've gauged from this conversation is just how vital first aid training for our canines can be. Is there anything, Dani, currently within regulations within the UK, or something that you think should be in the UK regulations for dog professionals specifically to be trained within dog first aid? So your groomers to your dog care providers, anyone that works with dogs daily.
Yeah, as a dog first aider, and of course I'm going to say this, when I'm benevolent dictator of the world, anybody with a dog in their life should have dog first aid training, right? So that is my manifesto. So people who work with dogs, people who have dogs as pets, I wholeheartedly and 100% believe, and it's why I do what I do, that they should learn these skills. And that's not because, because it benefits me financially. That's because I do this job because I'm passionate about it. I'm passionate about dogs having carers who are equipped to deal with scenarios. I also believe, parents and carers of children should learn this stuff as well. So this isn't about lining my pockets. I believe me, I don't do this for the money. But I firmly believe, because it's not just about saving lives, it's about reducing suffering, it's about getting dogs the appropriate treatment, it's about animal welfare, and that is 100% what dog first aid stands for. We are about doing the right thing for dogs and doing the right thing for people as well, because I have met through the course of my career with dog first aid people who didn't know what to do, who are coming on a course because they didn't know what to do, and their dog lost their lives. And believe me, it is very apparent how that has affected them. And, you can just imagine, particularly if you were responsible for the care of somebody else's dog, and because you didn't know what to do, that dog lost its life, how that would affect you. It's absolutely devastating.
Yeah, I can imagine.
I firmly believe anybody with a dog in their life should learn these skills. Now, in terms of legislation, legislation around dog ownership and dog care is severely lacking in the UK. Anybody could set themselves up as a dog first aid trainer. Anybody can set themselves up as a dog trainer, as a behaviourist. You don't have to have any qualifications. There's no regulations around what goes in food, what goes in toys, what goes in anything. So it is severely lacking in the UK. We have the Animal Welfare Act, which says that dogs are entitled to, or animals in this country are entitled to certain things: the appropriate environment, the appropriate diet, the freedom to be kept with or away from other animals, depending on their species requirements, and that they are to be kept free from pain, injury, suffering and disease. But there's no legal requirement for anybody working with dogs to have these skills currently. Now, as a business owner, if I were a groomer or if I were a dog walker or whatever, I would want this, A, to set myself apart from the competition, to demonstrate to my customers that I take the welfare of their animals seriously.
Of course.
But my biggest fear would be handing a dog back that's seriously injured that I didn't know how to deal with.
Yeah.
Like, from a brand reputation point of view, that's a disaster. and having responsibility for somebody else's dog. I remember the first time I took my niece and nephew in the car, and I drove like Mrs. Brady old lady, because that level of responsibility, you know, it was like I was a learner again. I was hyper alert because I had my niece and nephew in the car. So that level of responsibility with somebody else's dog, I think, is heightened. There is, if somebody is either a breeder or a home boarder and therefore needs a license, there is legislation that says that they need first aid training.
Okay.
And they also need to have, in order to get 5 stars, so you have a grading as a breeder or a home boarder, up to 3 stars, you don't need a level 3 in a relevant topic. But to get 5 stars, you need a level 3 qualification in something to do with the role that you're doing. So it could be in animal husbandry or animal care or dog training or first aid. That there is a move more towards stuff that is being licensed to push people to do this stuff. But as a groomer, a walker, you know, lots and lots of different professions, you don't actually need to have it.
So you've spoke loads about dog first aid today, Dani, and it's such an interesting topic, and I've learned, and I'm sure our listeners have learned so much about dog first aid and how they can help. But just before I let you go, I have to ask, what is the one thing that you would have listeners remember or take away from today's discussion? Just one, Dani. It's a tough one, isn't it?
Just one thing. Crikey.
Yeah, especially when it's all so important.
Okay, one thing that encompasses lots of things.
I'll let you away with it. It's fine.
Okay, I would recommend, and it's not even necessarily first aid related.
Okay.
I would recommend that people spend time getting to know their individual dog, what they look like, sound like, smell like, because on a regular basis, and doing checks on them on a regular basis, because our brain filters out, we get so much information on a daily basis, right? That our brain filters out stuff it doesn't deem to be important. So unless we're super focused on what is normal for our dog, it's easy to miss when something is abnormal. So for example, if I don't, you know, if I were to close my eyes right now, do you know what colour my eyes are?
Blue.
Okay, they're brown. So your brain...
I've been looking at them for like 2 hours.
Your brain filtered out that information because it's not important to you what colour my eyes are, right?
Of course it is.
Apparently not, right? So if we don't focus on what colour are my dog's eyes, what colour are the whites of their eyes? Are they creamy? Are they white? What's their normal heart rate? What does their skin colour look like? What's their normal gum colour? When we're looking for that kind of stuff in an emergency... we won't know if it's changed if we're not tuned into what's normal for our dog. So if I were to give if there was one thing I would say, on a weekly basis, give your dog a once over. Are there any signs of fleas or ear mites? Are their nails nice and short? Are there, have they got excessive dandruff? What's their normal gum colour look like? What is normal for my dog? Because there's such a huge variation. If you think about, at one end of the scale, a toy poodle versus a St. Bernard, different coats, different colours, different sizes, everything entirely different. So you would expect those to look different. But even within breed, you can have somebody with 2 labs and they've got lots of differences. And if we're not really tuned into what's normal for our dog, we can miss when something's wrong. And whether that is a first aid emergency or whether it's an ongoing illness or condition... and a perfect example is my dog Mally. I would check her eyes regularly, and I noticed one day she had a dark spot on her iris. So the iris is the coloured part that surrounds the pupil. And there's a dark spot on her iris. Now, if I wasn't checking her eyes regularly, I wouldn't have noticed that. But it was actually a melanoma, which is a cancer.
Wow.
But if you don't look at these details...
You never find it.
Now, in the event, we didn't treat it because she was 17 and the vet said it wouldn't be fair to enucleate a 17-year-old dog, so take the eye out.
Yeah.
And at her age, what we're going to do kind of thing. But if that were in a much younger dog, you would want to pick up on that as quickly as you possibly can. So yeah, my top tip would be get intimate with your dog and what is normal for them.
That's great.
And it's great for building a bond as well.
Yeah.
You know, touching them, smelling them.
Their little popcorn paws. Best smell in the world, isn't it?
Or digestive biscuit ears.
Yeah.
Love it. Yeah.
Thank you so much for joining us today,
You're
Dani.
welcome.
Thank you.
Thank you to all of our listeners. You can find out news about our podcast on our Instagram or TikTok handles, which is at Animal Friends Insurance, or on our Facebook page at Animal Friends Pet Insurance.